My name is Catherine Mason. I'm the chair of the board, and welcome to our first and maybe only virtual annual general meeting. Hopefully many of you have enjoyed the rather inspiring Academy of Research and Improvement conference. I'm led to believe that we maxed out at something over 400 people, which was really rather good, and that we had somewhere between 60 and 70 service users and their families with us. So I'm really pleased about that. So well done to Sarah Williams, and I know a very extensive team behind her who put on everything today. As this is our first virtual AGM, please do bear with us if there are any technical glitches. First section here will be more about user error, I'm sure, rather than technology. And there may be a lag between what you see and what you hear. In line with our infection prevention guidelines, we're all going to be wearing masks. I know that that will make it very difficult for people with hearing impairments, but we will try and speak slowly and clearly. And the whole of this event is going to be recorded, and then it will be uploaded onto YouTube with subtitles so that you can play it back. So first of all, I need to start by saying thank you. Thank you to all of our staff, all of those who have helped us out over the last 6 months through the pandemic. Our staff have continued to show a huge amount of commitment, dedication, and real flexibility to ensure we can continue to provide safe care. Your support, anybody who is out there who has given support to the NHS and key workers, has helped tremendously, not only in the actual support, but the very thought that people are supporting us. So thank you very much indeed. The AGM today should help us to have a look at some of the achievements and challenges over the last year. And at the end, there will be the opportunity to ask questions. Now, you don't actually have to wait until the end, and I'll tell you how to ask questions in a little while. So basically, we are going to be doing it all online today, and we'll see how it goes. So let us look now at the agenda. First of all, we will have Sue, who gives us a review of the year. Some of that in person and some of that by means of video. And then we will be having a little look at the year ahead. And of course, we actually have to do some of the formalities that are required of an AGM. So just to tell you that there are a copy of the minutes of the last AGM, which was held last year on the 16th of September 2019, and they're on our public website, together with our annual report and accounts, which is a snazzy looking document, although quite long, and includes our quality account. And you should be able to see the link on screen now, but more of that in terms of the publications at the end. Now, this is a bit that I have to explain that frankly I'm not very good at myself, so bear with me. So I'll explain to you about our virtual platform that we're going to be using this afternoon. So you should see slides, the main part of your screen, with the live stream of us at the side of your screen. Now, if you're on a phone or tablet, you should see a small button at the top right with circular arrows. Apparently, if you click this button, it will switch between the slides and the live stream. To ask questions, you click on the Q&A tab and then click on the plus sign to ask your question. You type in your questions as you think of them, so don't worry about waiting until the end. In terms of the slides themselves, those will all be downloaded, can be downloaded using the download tab, but they will be emailed to you directly afterwards as well. So before I hand over to Sue, just to sort of reflect on a couple of things over the last few months. And we have to remember the last few months weren't the whole of our last year. We had an absolutely incredible achievement last year in terms of being a great place to work, great care, and also great value for money. We'll see how we've achieved all of our targets as we go through. But I would like to again thank our staff who have been amazing during this crisis. And we have been joined right across the trust in terms of pulling together. And also, I think what has been particularly profound during the crisis has been the work that has gone on between trusts, between us and other partners in our systems. I think it has helped us all to get to know each other better and to work much more closely together. They are completely unprecedented times, but actually I think it's galvanised a huge amount of action. Thank you very much to staff who were redeployed, some of them inside the trust, but I've even heard stories of people being redeployed outside of the trust. And so that is a very generous way in which we have all achieved our objectives together. So thank you for those who are working and continue to work in different ways to deliver our services. I'd also like to say a special thank you to our volunteers, our student nurses, and those who have come back to work with us in the NHS. Now, there was a national call out, but this part of the world actually succeeded ahead of many of the other areas in terms of getting former employees and students to work in this area. So thank you very much for students who've taken extended placements. So we have had also donations from the NHS Charities Together. So thank you very much for that as well. We're going to be using that to help in terms of staff wellbeing. And it's not only the donations, but the sentiment, which is really, really appreciated. So thank you to anybody who generously donated. That certainly has made a difference for both our staff and our patients. So next I will hand over to Sue. But in terms of what comes next after that, we will have Nhs Finances, who is our Chief Finance Officer, and he will give us a quick summary on how the numbers worked out for 2019-20. So first of all, let me hand over to Sue.
Many thanks, Catherine, and hello to everybody through the virtual media tonight. I am Sue Harriman. I am the incredibly proud Chief Exec of Solent NHS. And I think I was reflecting at the beginning of the research conference this morning that it's a very different experience to be stood talking to all of you through a camera, particularly when I think about the previous AGMs we've had, where the room has been full of people who have interacted, who have asked amazing questions, and who have helped to work with us and contributed to all the success and the learning of our organisation. So this is a very different experience. Let me tell you a little bit about Solent, and I know many of you who will have connected know us really, really well. But the organisation came into existence in April 2011, so we're still a very young organisation. We provide community, mental health, learning disability, and a raft of other specialist services like sexual health and dental services across Hampshire and the Isle of Wight. We turn over at over £200 million a year, and we continue to grow, and that means our workforce continues to grow. We have over 5,000 people who work within our organisation, and that's not even counting all of the amazing volunteers that work alongside us. Every year we touch the lives of many people, and last year we touched the lives of over 1.1 million people through our clinical contacts alone. We're really proud of the work that we do, just not within our organisation, but across and with our partners. So that's Solent. So it always feels weird thinking about last year because we're so very much into this year and all that this year brings. And our review of the year this year is different. We're going to do that through a video because, let's be honest, there is no better way than to think about what we achieved and our successes and what we learned than through the eyes and the voices of those who provided services to and our staff as well.
As As an award-winning community, mental health and learning disability trust, we pride ourselves on providing great care, rated as outstanding by the CQC, being a great place to work and delivering value for money services. I'd like to share a few examples of how we've delivered against our priorities in 2019 to 2020. We strive to always deliver care that is personalised, based on patients' needs and priorities, designed by people in our communities and delivered with respect and kindness. We always try to provide quality care that is safe, evidence-based and responsive. We work closely with our partners to help reach even more people and care for them through even more stages of their lives.
We wouldn't live without Solent NHS, and they've helped her to get where she is now. So if it wasn't for them, we would be stuck basically, and she'd be still suffering without diagnosis of things.
They've just given us so many pointers and so much help, and he's come a long way, and he's going to need speech and language therapy for, it sounds like, the next couple of years. So I'm really glad that the service is here, so thank you.
Yeah, the care, they looked after me very well. Yeah. Chair's been great, they all have.
In 2019-20, we delivered more than 1.1 million service user contacts.
Building Blocks is our new service that we're offering here jointly with Solent. It's an early help intervention for families.
We've been able to do joint training, share resources, have cross-learning. We've had our NSPCC colleagues co-located with us to really enhance that kind of relationship building.
We met with a family that had been identified by the health visitor who had recently had a baby. Baby was about 10 weeks old and mum had been struggling.
And she had a little toddler as well, and the baby wasn't sleeping. I think she was really worried that she couldn't meet her child's emotional needs and also developmental needs. And what was fantastic was that the health visitor and Jane, the NSPCC worker, were together on this contact, and we could actually talk about building blocks, promote what that offer would look like and how we could actually help and support them, which is absolutely fantastic.
And baby soon started to settle. We went through the developmental ages and stages with the toddler so that mum could see that she was doing a good job and had met those goals that she needed to do.
I met Nabil about a year ago. He was a young man that had sustained a spinal injury, a low spinal injury, and he had also sustained an amputation.
Due to the complexity of this man, nobody wants to accept him. The mental health and the physical health issues are so complicated.
We started some teaching sessions to explain what the injury had done to his bladder and bowel and how that would be managed. The staff started to do his care, his physical care, and I oversaw that, and then he started to do some of his care and I saw that as well. Today, a year later, he's a young man that will tell you when his catheter is due a change, will be able to do his own bladder washout, able to check his own skin, and has the hope that actually he will return to university and be able to look after himself fairly well.
When you have schizophrenia, with the right help, with the right support, they can make it and make it big time. So we are very, very proud of Nabil, and yeah, he's part of the team at the moment. Yeah.
We are consciously committed to our communities and have a desire to authentically engage with the people we serve, planning, designing and delivering services based on what really matters most to local people. During the year, we've continued to work in partnership with people in our communities, groups and organisations to help us achieve our ambition of developing local services for local people.
I've supported Solent in making a difference to encourage people to improve the quality of their health and living independent lives, paying particular attention to obesity, alcohol and drug addiction. All the other speciality that I have is that because I'm a veteran, I pay attention to veteran issues. And I would like to feel that I'm paying something back. That's one of my skills. I can communicate, I have knowledge, I have networks and things like that.
The final months of the year were dominated by our planning and management of the COVID-19 pandemic. We are extremely grateful to our teams who have shown overwhelming dedication and commitment in helping us respond to the crisis. Our teams had to think quickly and innovatively to adapt the way in which we work to ensure that people could continue to receive care during completely unprecedented times.
Well, I remember thinking back to that time, the huge anxiety all of us felt. We obviously had all our patients on our books, the referrals were still coming in, and it was just really a very steep learning curve of how on earth are we going to support all these patients without being able to see them face to face. It looked like an impossible task, but as we worked through it methodically as a team, we all worked extremely hard at that time. Everybody was working flat out to just kind of think outside the box of how we could continue our service.
What we wanted to do is provide that personal touch as well with our patients. So normally in normal times they would come to us and we do the face-to-face exercise sessions, and we wanted them to have that as well at home and not just feel that we were giving them a programme that didn't have that personal touch. So what our exercise professional did was she's actually filmed the exercises that we would normally do, and she did it in her own home, and she did different stages of the video so that we could tailor it to each patient as well and give them an appropriate level of exercise to do. And we've had lots of patients say how grateful they've been that we've been there at a very sort of scary time for people, not only because of COVID, but because they had their own cardiac event that's just happened, and that's scary in itself.
We know that there is a clear connection between patient and employee satisfaction. Great care is delivered when people feel connected, involved and supported. Our priority of making Solent a great place to work is underpinned by strong values-based culture, supported by strong leadership throughout the organisation. We nurture growth, ensuring that everyone in Solent benefits from learning and career development. Solent is truly a great place to work. In the National NHS Staff Survey for 2019, employees rated us as an organisation that provides great care and makes a positive difference to patients. The Trust scored among the best nationally when compared with other combined community, mental health and learning disability trusts for the second year in a row, and ranked 8th in the country by Listening into Action when compared with all trusts.
I think Solent is a great place to work because it offers opportunities to be so innovative in terms of the care that you can deliver.
I feel valued. I feel like my feedback and my opinions are taken on board.
They've got lots of resources, there's lots of information available to staff, particularly during the COVID pandemic. They have provided a lot of extra support to staff.
I feel that I can, like I said, bring my whole self to work. And that I won't be judged. If I'm having an off day, I can just share that.
We've had to respond very quickly during this pandemic, and Solent has been very supportive of that. It hasn't put any barriers in the way for the changes that we've wanted to make for our programme.
It doesn't necessarily feel like a place to work, it feels more like a giant family.
During the year, a lot of hard work has continued, ensuring that our colleagues have the confidence and freedom to speak up, can raise concerns and know that they will be listened to and that we will act. In October, we received a national accolade from the National Guardian's Office for our positive speaking up culture. We were crowned the best performing combined mental health, learning disability and community trust in the country following our annual NHS staff survey results, where staff said they felt comfortable raising concerns. We were also the second highest Freedom to Speak Up index score in the country. Team working is at our heart. Delivering great care is underpinned when people feel connected, involved and supported to do their very best work together, and that their work is recognised and celebrated. During the year, we held a number of celebration events in honour of our staff of more than over 5,000 people. We increased the number of Schwartz rounds we held across the Trust. These give people the chance to share and reflect on their experiences. We've empowered and supported people to celebrate the difference they make. In 2019, we held a celebration of Nurses' Day in May. June saw our inaugural Solent Awards, a celebration of the incredible work from staff across the Trust that year. The Allied Health Profession Conference followed in October. We also held our inaugural non-clinical staff celebration day in March 2020. We strive to ensure that inclusion and diversity remains a top priority for us as an organisation, developing a culture where everyone counts. In 2019, alongside introducing a new equality and diversity strategy, we appointed a strategic lead and head of diversity and inclusion to formally drive our commitment forward. During the year, we also continued to develop and strengthen our diversity resource groups, including networks for disability, LGBT+ allies, multi-faith and Black, Asian, minority ethnic staff. These are forums for staff to share ideas, come together and be a driving change, making difference to employees.
Hi, my name is Pavan Lal. I'm chair of the BAME and Allies Resource Group. We formed in February 2019 with 17 members, launched in October 2019 with 24 members during Black History Month. During the COVID-19 period, our membership grew to 50 members, and after the tragic death of George Floyd and Black Lives Matter movement, our membership increased to 74 members, and that includes allies, and we continue to grow. Our aim is to be a thriving network with a powerful, positive voice advocating for positive change right the way across Solent.
One of the highlights for me during the year was hosting our first menopause event, where I had the opportunity to share my personal experiences with the staff across our organisation. The event involved colleagues coming together to talk about how the menopause has affected them or someone they know. Staff valued the chance to talk freely about an often taboo subject, and there are plans to provide further support. In 2017, we were awarded £10.3 million to redevelop and refurbish our buildings at St Mary's Community Health Campus, bringing even more services to the Portsmouth and South East Hampshire community. At Solent, we work closely with and involve our partners in our financial decisions. At St Mary's, we asked our service users and partners, Healthwatch, how they would like to see the site improved and have adjusted investments to mirror their feedback. Through these facilities, we are able to provide a one-stop, joined-up care experience for patients, meaning fewer visits to different places with one team working together towards the same goal. Plans are underway for a new £19.5 million scheme at the Western Community Hospital in Southampton, which will house a 50-bedded rehabilitation area for older inpatients. The money will enable us to extend and redevelop the hospital site, allowing us to enhance the patient experience, leading to better outcomes and offering an improved working environment for our staff. It should also help reduce admissions to University Hospital Southampton and free up vital space at the Royal South Hants Hospital, providing huge benefits for the wider health system as well as the local community. The last financial year saw us bring in many exciting changes to our IT and technology systems for the benefit of service users and staff, thanks to the continued investment we're making. Staff can securely access electronic patient records, clinical and office applications, such as Office 365, from locations away from the office, including at non-Solent NHS Trust locations and in patients' homes. More staff now have a smartphone and a laptop with mobile data, which enables them to have secure access to up-to-date information when they see patients, regardless of their location. We've increased the use of technology for remote video consultations with patients, allowing clinicians to speak and see them remotely at home using technology similar to Skype. There's been tremendous achievements right across the Trust, which we are incredibly proud of. In May 2019, Vanessa Bull, Learning Disability Nurse, won our inaugural Nurse of the Year award. In June, we were recognised as the country's best performing research centre in the category of care trusts for the number of people recruited into studies and the number of studies running in 2018-19. The same month, 4 of our nurses were awarded the prestigious title of Queen's Nurse: Susie Graves, Tracy Tudbull, Julie Southcott and Helen Ellaby. Also, the then Prime Minister Theresa May recognised 2 of our healthcare professionals, Beth Kelly and Sharon Steele, for their work around diabetes. In July, our nurse consultant for homelessness and health inequalities, Pam Campbell, won the National Lifetime Achievement Award at the Parliamentary Awards. September saw our diabetes specialists win a regional award for developing a new tool to improve care and safety for housebound patients. In December, our patient representative network, Side by Side, won 2 award categories at the Patient Experience in Quality Improvement Awards, hosted by NHS Elect. I'm so proud of Team Solent.
My name is Andrew Strevens. I'm the Chief Finance Officer and Deputy CEO. I'm here to talk about our finances for last year. The cover slide, I think for me, is very apt. What I'll try to do is try and give you the key headlines from last year. But in reality, NHS finances are immensely complicated. So I will try and do the simplified version for you. In terms of our finances, I'm incredibly proud that despite 2019-20 being a significantly financially challenging year for the whole NHS family, at Solent we were able to achieve a modest £100,000 surplus, therefore outperformed our control total, which was a break-even control total set by our regulator. To do this, we did receive £2.5 million of what was called Provider Sustainability Funding and Financial Recovery Funding, and this was awarded to us by NHS England. By achieving our control totals, we have now actually positively exceeded these for the last 5 years in the midst of transforming our services and improving them. This is an incredible achievement and has not been possible without the commitment of everyone across all the organisation, so thank you. We have also achieved all 4 of our statutory financial duties for the last financial year. Again, this is a brilliant achievement. We have 2 sets of auditors. The first, our external auditors, give us 2 opinions, and they are both unqualified. So there was an unqualified opinion for value for money and an unqualified audit opinion on the whole financial statements. This is an amazing achievement. Well done to everyone involved. And obviously, during the time of the audit, both the auditors and the finance team were working remotely. We also have internal auditors who are PwC, and their conclusion was an opinion of generally satisfactory with some improvements required. And in reality, that is the most positive audit opinion they give. So well done to everyone involved with that. Internally, we had an efficiency target, which is called a cost improvement plan, which was £8.1 million, of which we achieved £4.2 million, the balance being achieved by other measures. Achieving further efficiencies is proving more difficult as a standalone organisation. And in reality, future efficiencies will need to be delivered through system transformation. For 2020-21, we did initially have a control total that was given to us by our regulator, which was a break-even one, which included £1.5 million of financial recovery. Due to the pandemic, which was declared in March, effectively all financial rules have been eliminated. And the national government has set all organisations within the NHS funding to enable us to break even the financial year. And we've been working to guidance for the first 6 months, and that guidance has been revised recently, and we'll be operating that for the next 6 months. To achieve what we need to achieve, we'll be working with our system partners to ensure that the resources are deployed correctly across the system. With all this in mind, we remain committed to delivering the best value for money, achieving both efficiencies internally and externally, and working with our partners. Thank you.
I now get the opportunity to talk about what makes me proud, or what has made me proud. And I have to say that when we were preparing for today, I was told to not talk forever because I have a track record of spending far too much time. So I've had to think really carefully about what I want to say. I guess the first thing is just to reflect on the video that you have seen, and to talk about my pride in relation to the staff within Solent and the partners that we work with and the volunteers that support us as well. I think what you saw through the video is that we have an amazing group of people who work with us, who are creative, who are part of our team, part of our family, and I'm so incredibly proud of that. And they achieve so much. The things that make me proud as well is what the people who use our services and what they say. That's the most important thing. We know we're doing the right thing when our patients, service users, their families, their carers tell us that we're doing the right thing. And at the same time, the culture in the organisation, I think you saw that in the video, evidenced through our Freedom to Speak Up Index, says that when we have learned, when we've made a mistake, when things don't go well, when we could do things differently, better way, we listen and we respond and we learn and we change. And that makes me proud. And that's why hearing what the people who use our services say is so very important to us. I think the other thing is our work with partners as well. We've always been really clear as an organisation, we can do nothing on our own. And our partners are other NHS organisations, authorities, voluntary sector, charitable sector, and our patient service users and their families. So much of what we do with our partners. So that's what's made me proud, and there's many, many more things that I could share with you. So let me look towards the year that we're in now, and it's been a different year, hasn't it? We started to recognise the impact of COVID in March of this year, and our services have responded amazingly. Again, you saw some of that through the video. So we are now 6 or 7 months into living with COVID, and I, like you, we can see that COVID is coming back into our lives, and we need to think about how we can maintain our services safely, making sure we can provide access to everything that is needed for those who use our services. But at the same time, we need to really look after our staff. Our staff have given 110% for a long, long time. And we ask them to do so much, and they give so much. So our focus has to be around the health and well-being of our staff, listening to them, supporting them, encouraging them to rest, to look after themselves. We know that if we do that, our staff will continue to be amazing for us. This year as well, I think we have learned so much around working with equality and inequality. One of our values is around everyone counts, but I think this year we've taken a step back and really reflected. You heard reference to Black Lives Matters in the video, and I think for us it's given us a real opportunity to step back and think about what we do, how we communicate, how inclusive we really are. And I think that as an organisation this year, we want to go even further with our approach around engaging just not those from Black, Asian, minority ethnic groups, but all parties, and to make sure that we're true leaders. So we have more to learn and more to do. And then finally, I would say our relationships with our partners are really important for us this year. We have a special growing relationship with the Isle of Wight. We have many services on the island that we provide already. We've been walking alongside the Isle of Wight Trust to support them with their mental health services. It's a very positive relationship. They're incredibly important to us and to our services in Solent, and that will be really important for us. So many things to think about for this year, but it's still an exciting year, a year of opportunity and a year of change. So now's my time to hand back to our chair and to Catherine.
Okay, so now we're going to open up to questions. I won't take any of the difficult ones. We've got the experts behind me here. Apologies come from Helen, who is unwell at the moment, but if there are any questions relating to people or workforce, I think we've got depth and breadth in terms of being able to ask them. In terms of if we end up with too many, people, two things. One, if you put your thumbs up against the one you particularly want to see, so that we all know it's a particular popular question that a lot of people want to ask. And the other thing is that we will try to get back to people after the meeting to answer any questions we haven't been able to do so far. So the way this should work is I'm going to look over here, I'm going to be given the question, I'll repeat the question, then I'll pass it to our experts here. So, first question, Rachel.
Do you have sufficient PPE for the forthcoming period?
Okay, so the question was, do we have sufficient PPE for the forthcoming period? I'm just going to turn around and check out. Is that one for you, Gabby?
Yes.
Yes.
Hello, my name is Jackie Ardley. I'm the chief nurse here at Solent. And the answer is yes, we do. We're working very, very closely with the providers, and we work very closely with our staff on the front line to ensure that we have the appropriate PPE for our staff and for the patients.
Thank you very much, Jackie. So, on to the next question.
Next question is
Okay, so somebody's interested in how we're doing on system working. So that's working with CCGs, other trusts, local authorities, voluntary sector. How are we going to work across the system, and what are the plans going forward? Not sure, Sue?
Thank you. So a direct question about the CCG and the changes, and I think probably my answer would say it's becoming increasingly clear and indeed right and appropriate that the NHS, which is one big family, becomes a blended family. So we are working really closely with all of our partners, as I mentioned earlier on. In relation to CCG, I think we're going to see commissioners and providers working much more closely together, planning and delivering alongside each other, making decisions collectively, working to shared outcomes. So we have always worked really hard to have really strong, close relationships with CCGs to ensure that they hear and listen to things at the same time as we do, and that we share the learning, and I don't see that changing at all. I've had the great privilege to work with Commission colleagues across Hampshire and the Isle of Wight over the last few years. Those relationships are very positive, and I think they will continue to be so. So we will support all of the changes that are happening in the CCGs, and I think alongside that, I'd want to see changes from the providers, as I say, as we start to create these really integrated teams.
Okay, so our next question is,
how important is it for our staff to speak up about fear of judgment or being reprimanded?
So the question is, how important is it for our staff to be able to speak up without being judged or reprimanded? Before I pass this question on to be answered by anybody else, I'd just like to say the answer to that is it's really, really important, because I can tell you that from the board's perspective, we hear about feedback through freedom to speak up every single board meeting. We value very much feedback. We value very much the opportunity that staff have to be able to say what they see, say how they feel. These are really important matters, but let me see if somebody wants to add.
So it's me again, guys. Sorry, responding to this one. So this is absolutely fundamentally, crucially important, and I think it is really important that we feel safe to bring all of ourselves to work, and that psychological safety that we would want to in the culture of Solent that we would want to create is really important for people to be able to speak up when something doesn't go well, because that's an opportunity for us to learn and to respond. We want people to be able to speak up when they don't feel safe, because we want to do something about that. I think it would be disastrous if we had an environment where people were feeling that they weren't being looked after, weren't supported, weren't being listened to, great ideas weren't being responded to, or indeed mistakes were being made and they weren't being shared because they missed opportunities for learning. So the safety and the speaking up culture in the organisation is really, really important. I would love to say, as the Chief Exec, that everybody, all 5,000 plus staff in the organisation, feels safe and able to do that every single day, but I think that would be really naive of me. So we work really, really hard at creating a culture where we can get even better at creating that safety for our staff to speak up. So I completely believe that it is a major key to us being the best we can possibly be if people feel safe and able to be themselves and bring their whole selves to work every single day. And I think that's what's helped to create some of our learning culture in our organisation. And at the end of the day, I really believe we are all human beings, and humans will make mistakes, things won't work. We'll all have days where we don't quite feel ourselves. And if we can share that and bring all of that to work, then we will be supporting and looked after and feel much safer, and our learning culture will continue to work.
Some great questions coming through. What's our next one, Rachel?
What community engagement activities are we doing to ensure Solent engages with people it serves?
Okay, so this one's about community engagement, asking us about the activity we're doing to ensure that we are engaged with the people we serve. Something that I think is really important as well. So,
thank you, Catherine. Can I just start by saying that I am so missing not having all the people in the room. I was thinking about last year and it was buzzing here with people asking us questions and being able to chat afterwards. So what are we doing? So firstly, a really timely question for us aboard. We are about to take a new strategy, which is about beyond and working with the communities we serve. It's going to be really exciting. At this moment in time, our lead, Sarah Bouchin, has engaged through people, over 10,000 people across our communities to help shape what I think is going to be an exciting future that we would want all of you to be engaged in. And when we think about communities, I noticed on the video, one of our staff talked about a family, and in a way, Solent is a community in its own right, and we are communities that we work with around us. So we have really big plans. We don't have the delivery plan, because if we did, it would be ours. The work that we want to do is work with all of the individual different communities to say, what do we need to do with you? What do you need to help us drive? Rather than us coming with a list of things that we want to do. So that's the premise of the way we've worked. We're really excited about it. People who've been engaged, involved, which include our staff, families who use services, people who don't. I think we're in for a really good journey, and I'm sure the board will join in and sign off the strategy Monday week. So if you want to join our public board, sorry Catherine, we'd really welcome you all to come along and hear about it. Thank you.
another crowd pleasing event coming up a week on Monday. So, next question, Rachel.
What are our plans for returning staff into the offices?
Oh. Now, what are our plans for returning staff into the offices, and how will that be implemented? Who wants to say that one?
I think what's really important is that the environment in which our staff work is safe and secure. And I think it's also important to acknowledge that there are many of our staff who work in clinical environments, working directly with patients. And it's keeping those environments COVID secure, making sure the right amount of protective equipment is available for them, that they feel supported and understand what's important about hand washing and so on is really important. We all heard the Prime Minister in his address to the nation earlier on in the week, where he said that it's time to go back to the original approach, which is to people working from home where we're able to do so. At the beginning of the COVID outbreak, we went through a set of changes that really supported an enormous number of our workforce to actually work from home really safely. And some of that actually I think was because we had invested and thought about our digital offer to staff, so they were able to access everything they needed to from home. And we found actually that's created enormous benefits for many people: work-life balance, lack of the commute into work, and some people have loved it. Some people have found it challenging actually, and they've felt quite isolated and unsupported. So what we've been doing over the last month or so was considering how we can safely allow people to come back into the workplace in a COVID secure environment. And you'll see today we're in a COVID secure environment, wearing face masks in a room that only allows so many people in and respecting the distances between us. So we've been working really hard to bring those people back. I think the announcement from the Prime Minister at the beginning of the week means we're now reviewing that and will be supporting all of those staff who can work from home to work from home. And it's something that needs to be done very, very carefully, because the health and well-being of our staff, wherever they are, is really important. We may need to make sure that they're able to do their jobs well and effectively without it having an impact on them and their families and their home life. So we will be following the guidance as we have done all the way through. And everybody who can work at home safely will work at home, whilst at the same time respecting that a massive majority of our organisation is actually working in the clinical workplace and have been through the pandemic.
Okay, so we're really piling through the questions now. How are we doing? Have we got any more? Yeah. Okay, what do we got next? Oh, support for veterans and our developments there. Now, this is a back row challenge, I think, isn't it, David?
Thanks very much. Hello, I'm David Noyes, Chief Operating Officer for Southampton County-wide Services, and I'm responsible for what we do in the veterans space. And we've got a number of different interventions and schemes running to support veterans and the community. There's an internal veterans network where veterans such as Sue, our Chief Executive, and myself, and a whole range of others occasionally come together and support each other and talk about issues of the day affecting us. But perhaps more importantly, off the back of that network, we reach out to the veterans community in our area, where there are obviously a lot of ex-military and naval personnel, and we offer to reach out to those guys, and particularly people who are about to leave the services on transition, and offer them support, advice, guidance, occasional work placements to help them on their transition journey. But elsewhere, we also support a veterans drop-in centre in Woolston in Southampton, which is successfully running and supporting a number of veterans in the region and runs breakfast clubs and the like. We're a leading light in the Portsmouth Military Mental Health Alliance with partners from both the statutory sector, our colleagues in Portsmouth Council, ourselves obviously working in conjunction with the Navy and Army organisations in the area, and third sector organisations in the area doing interventions for mental health of our veterans community and their families in the Portsmouth area. And we have recently taken on a bit of business running a high intensity mental health intervention service for veterans across the entirety of the southeast of England, which we're sort of lead provider for, but delivering in conjunction with provider partners from across the whole southeast region.
Excellent. Next one.
Do we think we have entered into conversations and plans regarding restore and reset to learning in the second wave?
Oh, so the question there is, have we, do we think that we've started on restore and reset preparations too early on the basis that the second wave is now upon us? So, I don't know. Dan.
Thank you, Catherine. Good afternoon. My name is Dan Bayliss. I'm the Chief Medical Officer. It's nice to have an opportunity to come and answer a question. First of all, as this is my first time up, I want to say that I'm 6 weeks now into this role, and I hope that people who are watching, I can imagine this virtual audience in front of me, understand why I wanted to work at this organisation. And like my colleagues behind me, I feel incredibly proud having watched that video. The question about restore and recovery really is a question about how we work together as a team, not just within Solent, but also with our partner organisations, listening to the third sector, patients, listening to our staff about how we reacted to this amazing coronavirus pandemic. What we did initially back in March, I still think about those days regularly, how we responded then, what we did in the first few months, what we learned, how we restore certain services, and absolutely at the moment what we're really focusing on is how can we catch up on waiting lists, how can we deliver that service that we owe to the people of Hampshire and the Isle of Wight. And now we're all feeling it right at the moment following the Prime Minister's announcements this week. Now, how can we look ahead to get that learning and put it into practice as we go into the second wave? So no, we're not talking about this too early. This is just a continuation of an ongoing conversation which will continue to happen probably indefinitely as we go from now to coronavirus to all the challenges that we have to meet together as a system going forward. Thank you.
Excellent. So, and more questions still? Oh, excellent.
We have a question about how are the board connecting with the services in the front line?
So the question is, how are the board connecting with the services in the front line in these difficult times? I ought to have a really crack on this one first. Excellent. So I'll crack on first, and people can supplement as necessary. So the board have always very much appreciated visits out to see our services in action. So we have what we call board floor visits. And I have personally always enjoyed those board floor visits. You can listen to what is provided for you in a boardroom, but it is always really, really important to triangulate by means of meeting the people, delivering the service, and hearing from service users who are using the service at the time. And I've valued that hugely while I've been here. Now, inevitably, we've had to review how we do that so that we don't import infection or risk or compromise safety in our service delivery environments. However, we have started to do virtual board floors, and those have been really, really helpful. So it's not quite the same as going in and seeing a service and being there. However, I think as people have adapted to the way that the virtual environment is delivered, they've also got more used to being able to be candid. And I can be absolutely clear that the board floors that I've been part of, and I think I've done all of the ones that we've had so far, the board floors that we've had so far, I'm really heartened by the culture that allows people to tell us all of the good things that have been going on, everything that they're really, really proud of, and there's a lot to be proud of. But but they've also been really candid in telling us as board members the things that we should spend a little bit more time looking at or that haven't gone quite so well, and being able to put things to us. And that has been immensely valuable. So we are endeavouring to replicate our board connection with frontline services, but through a virtual means, in just the same way as we did do physically. Although I have to say, board colleagues and myself will be very pleased when one day we are able to actually make our visits in person. I don't know whether.
Just to build on that, you know, I think we've tried to reach out to people in many ways. I've been involved in talking to people through the power of Teams and Zoom, so the technology, the data, and actually I've been able to see 70 or 80 people all at once, which has been fantastic. And as Catherine said, it's created an environment where people are feeling safe to talk about how things are feeling and we're responding to that. But then we've provided communication, education, learning. We've even had exercise groups. We've had coffee chats and all sorts of different things to be able to create as many ways as possible to connect. But actually, at the same time, where it's right and appropriate and where it's safe, the members of the executive team have had physical presence in services in frontline areas as well. So I think our contact is different, but I would suggest that actually we've actually had more ways to connect with people, which has felt really good.
Okay, so what you can't see behind is that there are cue cards coming up. Do we have time for one more question? Yep.
Are we planning further menopause?
Oh, Sue, that's probably you back up again.
So yes, we are. So I think this started with me talking about my menopause at work. I'll be really honest, and I was completely amazed by when I started the conversation, the amount of people that said me too. And I think what the other thing I realised is that it wasn't just me that was struggling to come to work and be my best self. There were so many others. It was a really powerful experience for me, for everyone involved. And what it says is that we will do more and more of these. We've got some amazing experts in our organisation as well who can help us and guide us. And it could be menopause, but it could be any other subject where actually as a group of people we can come together, learn more about each other and support each other. So yes, absolutely. And I really enjoyed those sessions. We will do more.
We are also blessed in this trust in having a menopause expert as well, who has shared her expertise as well. Now, sadly, I'm going to have to round us up at this point. But thank you very much to everybody who has been able to join us today. Thank you very much to the team who've been answering the difficult questions. And thank you very much for everybody who has been involved in ensuring that we deliver great care, that we're a great place to work, and that it's great value for money. Now, on the basis that it could be the need, we might need to have virtual meetings into the future, we'd really value your feedback. So at the end of this, if you can stay on after the presentation closes, there would be a few questions to answer. So if we have to do it again, you need to answer the questions, because if you didn't like it, you'll get it again. And if you did like it, we need to know. So thank you very much for your attendance today. And if you can give us a feedback, that would be really useful. Thank you very much.